I wanted to show you another set of studies here, another patient. Just looking at this, just right off when you first bring this up, this heart is huge, okay? You can tell just from the other one that we just did. This is the anterior view. Notice when this contracts, notice that there's part of this is the apex of the heart. Notice that this part of the heart's not moving here. I bet you this guy has had an infarction in the apical area. You see that right there? This right here is the anterior wall. This is the inferior wall. Anterior wall's contracting nicely. Inferior wall's pretty good. But look at that apex held up right there. There's something going on with this patient. Definitely cardiomegaly, cardiomyopathy. Okay. Let's take a look over here. This is the 45 degree. Actually, this patient was about a 40. Note again, the spleen is down here. It's the beautiful separation. Nice job, whoever did this tech. Nice job. Notice the motion. So when we're talking about Muga scans, we're looking at the function, okay? This is like similar to the when you do a stress test. You could say this is the septal wall here. This is the apex. This is the lateral wall. Looking at this, what's beating and what's not. Lateral wall is doing okay. Septal wall is sitting there. You see it? Just sitting hard. It's not going in. It's supposed to go in. Apex is hung up too. It's not contracting in and up. The right heart, this is the right heart, the right ventricle is doing all the work for this patient. Glancing at that, you know that this is abnormal. Number one, the heart is increased in size. Number two, at least two walls of the heart are not contracting, are not pushing the blood up and out. The third view, the lateral view. Look at that spleen. Man, looks like a moon. You can see that the apex is just sitting there. The sides coming over. Right here's the anterior. It's looking pretty good there. This is the anterior. This is the apex. Down around this region here is kind of sitting there a little bit. So definitely there's something wrong. So let's go ahead and see what processing's all about. You would hit exit right here. We're going to select the one that we're going to do. We're going to load it 40%. Looking at the regions, yeah, you know what? I think the computer did a pretty good job this time. Well, let's take a look. You know what? I might take a look a little bit at the other ones just for giggles, okay? We're going to modify the end diastole here. Look at how the computer drew it. That's not too bad, actually. Every mouse is different. Every place you go to will be different. Some places I will just take this mouse and just drag it around the left ventricle. Here you have to do click, 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 click. Every place is a little bit different. I'm going to move in a little bit right there. Do you see that? I moved a little bit closer. Okay. I have to go over here into the end systole. Okay, good, and it's about 41%. So, just comes to show sometimes it does, the computer does come up with the right amount.